very good evening, distinguished guests, speakers, and doctors. And it was a pleasant surprise for me that when I landed up here, Dr. Ravi told me that, hey doc, can you just give your a little bit of experience with tension. Now if you look at the reasoning why as a doctor, of course being an allopathy, I should tell you that I'm an ENT surgeon with 22 years as a doctor. Now if someone comes and talks to me and tells me, hey doc, there is some herbal preparations or alternative, I rather would refrain from going into it. The only reason is that, is it FDA approved or not? Because for us, the main team or the group which has to say you can use it is FDA for us. For an allopathy doctor, it is the one. And when I heard that parsley has something to do with the FDA and they have applied for a clinical trial, I said there is something. Up to 2008. Even today, recently, last week or 2 weeks back, I did pick up my clinical trial, which I have individually done on my individual patients. I have documented it. I will give the Danshan to my patient and record it. What date, what are the improvement after 1 week, after 2 weeks, after 3 weeks, after 4 weeks. And of course, I do consume Danshan once in a week. Yes, I do consume. But initially, I did take twice a day. And as of today, I'm very healthy. I have no problems. So in that way, what is that which really attracted me to this Kasli, which is now Tasli, is number one is the microcirculation. Let me tell you, in the whole world, I can boldly talk about this. There is nowhere in an allopathy way you can tell that there is a microcirculation and there is a machine which can see your microcirculation, and this is the problem you all have. I have never come across. It's the first time in my life I come across, hey, this company is showing me something, a beautiful microscope wherein you put your hand and you can see the circulation live. It attracted me, hey, there is something very beautiful. In fact, my heart even now goes that every doctor should learn this beautiful technique of microcirculation and implement it in our day-to-day practice. Why not? You should. There is no reason why you should not. Number two was, when I visited China, Beijing, wherein I went to Tianjin province to see the company, it's marvelous, ultimate. There is no doubt about it, it is one of the top line companies in the world. Even though it might be a traditional medicine, I salute Dr. M, who is doing a wonderful job of making it perfect to every soul in this universe, that they all should be helped in one way or the other way. And when I could see with the microcirculation, there is some benefit. And this was the first product in the world. We are talking about a microcirculation being improved. But today I can boldly tell Danshan is one of the top line product even today for my patients. And I have one of the top line testimonial. One patient was admitted in the ICU. Suddenly it was on December 12th, I think, 2007. His wife is crying and calling me, hey doc, do you have anything which you can help me? It was a Monday morning, and Tuesday the doctor said he has to go for an emergency CBA bypass operation. And Monday morning she did call me and say, hey doc, is there any way you can help me? I said, I wouldn't be able to assure you, but why not try this? So I put 2 capsules of Danshan 3 times daily on Monday, and Tuesday morning this guy gets up and said his pain has relieved. He was in the ICU. And then what this gentleman boldly has told the doctor, doctor, I don't want any operation for the timing, can you give me 1 week? And the doctor said, no, you have to, but he said, no doctor, I am not interested in going for the operation, give me 1 week time. And this beautiful guy, what he did was he took the capsule 2 capsules 3 times daily for a week, and after that he went back home. And today, I can boldly say that this guy has not gone for the operation, and he had 6 blocks, all cleared, you know. And one of the beautiful top line testimonies in my this was in an ICU. And even today he's still consuming the thing, almost 5 years now, he's still consuming. And there was another girl who had juvenile diabetes and uncontrolled, and her one vision totally out because one eye was already gone, there was other eye blurring. And this girl also, I did put Danshan only. And after 3 months she says, hey doc, now I can see everything very clearly. That was another very good testimony I got back. There was another guy who did, of course he had a stroke patient, and of course I have treated a few kidney failure, means people who are supposed to go for dialysis, but after putting them on Danshan they are not. So like that, if you look on, I have a list of things, of course in my whole career as a doctor, professional allopathy doctor, there are a lot of things I am looking at it, and even today I do prescribe Danshan Plus because that's one of my favorite products. And today I would definitely say that we need to join hands with a company which does something very unique, and that's what Tasley is doing. It's unique, that's it. Now, I may be an allopathy doctor, so what? It's doing something unique, it is ultimately helping our patients. What is our goal is to improve the things to our patients. When it's doing that, why not? And the other definite laurels which I would give it in Tasley is, we have around us, there is one gentleman called Dr. Ravi, and I'm really very proud to say that he is the first Indian in the world to put a footmark in China, which is ultimate, and I salute him. This is not an ordinary thing. Forget about Danshan and other things. This is not. If he has done that, there is something in that. It is not just like that he has gone and he has put in efforts and he has done it. And of course, there are a lot of laurels which Dr. Ravi has achieved as an Indian. I feel really proud of you, Dr. Ravi. I salute you for whatever you are doing. Not only Indians, we human beings, we can help each other. And in that way, as a professionally doctor, this Tasley's Danshan will be one of the top line, especially if you are talking about blood circulation. It's definitely far better than the Ginkgo biloba what you are going to put, definitely. Because Ginkgo biloba also does it does increase your circulation, but the way Danshan does is something amazing. So if your road is highway is very clear, your journey is more easier, and that's what happens in diabetes also. This is my favorite product for diabetes. I put for diabetics, after 1 week they'll come and say the sugar level has gone down. So how is that? It's very simple. Of course the road is clear, the drugs goes there and it starts functioning with the cellular level, and it, of course glucose uptake is there, automatic it is. There is no big deal about it. If your circulation is good, your path of metabolism also has to be good. Then there is automatically, when the metabolism is good, of course the excretion also of the same unwanted waste material is also good. Then everything goes fine. So what's a big deal about whether it's a traditional Chinese medicine or not? For me as a doctor, it does wonders. Why not? You can learn the microcirculation and do a lot of for our future. It is a very important tool. So thank you very much and have a wonderful evening. Thank you.